Hello, my name is Allison Warner, and I'm the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know about to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, it's so good to see you.
Thank you, Allison. It is good to be here. Which episode of In the Sterilization Room with Jackie is this?
I think we are on number 48. We are coming up on 50.
Throughout the pandemic, we've been discussing and sharing information with all of the viewers about what's changing and what we've learned, and new guidance from OSHA and CDC on how to safely navigate through this pandemic.
Exactly. So we're actually going to talk about, what's new today with CDC. But before we get started with that, Jackie, I'm going to check in. Where are we in the pandemic that orthodontic offices need to know, or what should they be aware of right now?
Well, Allison, last week, if you looked at the map of the United States on the CDC website, the entire country was red. Now, that means that on that CDC level of community transmission, that the entire United States was above 10% infectivity for all of the tests that were being done in each state. And that's due to the Delta variant. That Delta variant of the virus is so much more infectious. And of course, in July, we also had a relaxing of mask wearing. In May 13th, CDC had said fully vaccinated people could remove their mask. And my perception was that both fully vaccinated and non-vaccinated people removed their mask in public situations. And July the 4th came, a lot of people traveled, they took that vacation that they wanted to, and yet the Delta variant was spreading more infections, and we saw the number of infections and hospitalizations just really escalate. And it was a steep curve on the graph that you looked at, and community transmission went well above, as I said, 10% for the entire country, and put us in the red zone on that scale. Now, the scale goes from blue to yellow to orange to red. Red is above 10% infectivity within the community, and we should be taking all precautions. Universal source control within our orthodontic practices especially. When we get into the orange zone, which is down between 8 and 10% with it, then you need to be taking precautions with it. And then when you get into the yellow zone, that is between 5 and 8%. So it's sort of the intermediate type of precautions with it. And our goal is to get under the blue zone 5% of infectivity in our community. At that point, we can start reducing precautions and really resuming normal. And that's important for every orthodontic team to know what's your community transmission. Now, this week, we have 3 states that have moved into the orange zone. They're between 8 and 10%. California and Vermont and Connecticut, I believe it is, are the 3 states that moved into that. So again, not much of a relaxation of precautions that you would take in a healthcare facility. And then the other concerning part of infectivity for us during the pandemic at this time for orthodontic offices is the high number of children. Just 2.5 weeks ago, children represented 20% of the new COVID cases that were diagnosed. Then last week it was up to 25%. This week it's already 30%. And we can again contribute that to starting back to school. So many of the children are going back to school. There's a variation from state to state, and even school system to school system about whether you wear a mask or you don't wear a mask. Of course, children up to 12 years of age are not vaccinated. And we only have 50% vaccination of the 12 to 16-year-olds that are eligible for the vaccination. And we have teachers that are not vaccinated. So we're seeing the school system as a source of transmission, and we're seeing an increase in that infectivity. The good news for us, though, Allison, is when I looked at the numbers this morning, I did see a slight decrease in the numbers of infections nationally. So I'm hoping that this fourth wave, if you will, that we've reached our peak and we're going to see a decline in those new infections. But time will tell. It depends on our human behavior, whether we're all taking those precautions of wearing a mask, social distancing, hand hygiene, and being that all of the precautions, disinfecting surfaces. Those are the 4 basic precautions, even when we're in public and social situations for it. So we're not out of the pandemic yet, and we continue to get new guidance from both OSHA and CDC.
Well, on that front, on September 10th, so last week, the CDC published online a consolidated web page for healthcare guidance related to COVID. So my question is, first, why did CDC do this now?
Well, there's been such a fire hose of information coming out that all of healthcare was confused. If you were in a dental office, you'll read one web page and you'll go, well, this is for hospitals. Does this apply to our orthodontic office? Or this is for medical, or that's for nursing homes. And then you looked at the dentistry current web page before this publication, and it was dated December the 4th. There's been a lot of new data, research publications, new information put out since December the 4th. So CDC realized that there was a lot of confusion, and it was almost like, the say, a dog chasing its tail. When you would go on the website trying to look for how long do we need to quarantine for this, or if this specific patient, we had a patient call back and 2 days after they were there for their archwire check, they tested positive and they didn't let us know. What do we need to do? We have 2 team members that are not vaccinated, the rest of the team's vaccinated. Who needs to do what? What do we need to do? Testing, quarantine? It was confusing. So to clear the air and give some more specific direct guidance, CDC consolidated all of healthcare guidance for this one web page. Now, the dentistry one will still remain up as historical because there was good basic guidance there, but it'll have a banner at the top of the page that'll say, for the latest information, please go to this consolidated healthcare infection control guidance during the COVID pandemic. And there were a couple of changes, but basically it was a consolidation of information for all of healthcare. As a microbiologist, I look at this virus and I go, it makes good common sense. This virus doesn't know whether it's in a medical office, a pediatrician's office, or an orthodontic office. It's an airborne disease, and we should all be taking precautions when they're the same circumstances. Or, is a patient infected? Or basic guidance, are we doing aerosol generating procedures or non-aerosol generating procedures?
Exactly. Well, you did mention that there were a few updates. So what did CDC release in this new healthcare guidance?
Well, since this information is so new, you're going to see me glance at my notes here that I put together because I wanted to give accurate information. And one of the first things on this new webpage that your readers or your viewers will look at, and if you'll give them the link to go to it, then they'll have that specific link with it, is CDC states that all healthcare providers should be aware of community transmission. So you need to know what's the infectivity in your community this week, or even this day. As we talked about earlier, it changes from week to week. And I know in one of our previous episodes, we talked about where can an orthodontic office go for looking for your community transmission. And you can go to the CDC COVID-19 tracker, and that'll give you information. It's a little more cumbersome to work through for me. You can actually go to cases, infectivities, and deaths, and then you click on county transmissions, and then you can go to your county with it. One that I find very easy to use is the Johns Hopkins website. And I go to the Johns Hopkins COVID data in motion every day. That's the first thing I go to in the morning, and I will look at it, and it gives me a summary really of globally, where are we in the pandemic. Then it drills down and gives me infections and deaths within the United States, as well as vaccination rates. At the top of that web page, if you click on the tab that says regions, it lists all 50 states. You can easily click on your state, and then as you scroll down the page, it gives you a map with the infectivity for your county. So you just click on your county, you have immediate access to what is your percent of infectivity in your county. And I just keep a record of that infectivity. Maybe keep the record weekly where you're doing your employee screenings for symptoms, so that you have documentation of, hey, we were in the red from now until October the 1st, and then on October the 1st, we moved into the orange zone, and then you'll know which precautions you need to take and have documentation should you have an incidence or high risk exposures during that time. So know what your community transmission is, keep a record of it over the time. And then if you are, when in that upper levels, let's say the red, the orange, or even the yellow area, there are three things that we've pretty much all been doing is screening patients. Do you have symptoms? And that's one of the things that's required by OSHA at this time. If we continue to screen patients for symptoms in our orthodontic offices, then we're not part of that emergency temporary standard that OSHA put out and don't have to be in compliance with that. So screen for symptoms. However, the good news is neither OSHA or CDC at this time are including in that screening taking temperatures. So if the orthodontic office chooses at this time, they could discontinue taking temperatures on their patients as they come in. I just recently spoke with a dental group, and one of the dentists in that group said, oh no, I have really high infectivity in my area. We are 26%. I'm going to continue testing temperatures on everybody because if they have a temperature, they're infected with something. It may not be COVID, but it could be another disease on it. So knowing whether they are have any signs or symptoms on it. If they've had a positive viral test, they should not be coming into your office. If they're under quarantine because they've had a high risk exposure, they're not vaccinated, then they should not be in your office at that time, or if they're under any other work exclusions. And CDC stating you should post this on your front door so that patients know, hey, and post it on maybe your when you're doing your text messages to confirm your orthodontic appointment. Hey, if you have had a positive viral test in the last 10 days, if you're under quarantine for any reason, if you have any of the symptoms, please call us and let us reschedule your appointment. So you should not be seeing any of those patients. No one should be entering your office, even the UPS, if they meet those three criteria on it. Now I'm just going to go ahead and plow through this of what it means to an orthodontic office with this new CDC posting. And the next one that I think was real important for us is if you have a healthcare provider who had a high risk exposure. Now, we need to redefine again, what's that high risk exposure? You and I were talking about it before we even pushed record on our interview with it. That high risk exposure is exposure for 15 minutes during a 24-hour period. It doesn't have to be 15 minutes consecutively, but 15 minutes unmasked to someone who either has tested positive, has symptoms, or calls you back and say, hey, we tested positive the day after we were in your office, and for some reason you were next to them without a mask on. This is usually going to be, though, this type of high risk exposure at this time is going to be social, right? It's going to be at home. Maybe an orthodontic assistant's child comes home from school and has an infection, has tested positive. Of course, you're cohabitating with them, so you're not masked at home, and it's greater than 15 minutes. And so that could be that high risk exposure with it. And so now that we've defined that, if you have that high risk exposure, then CDC is currently recommending 2 viral tests after that high risk exposure for unvaccinated people. And those 2 viral tests are, number one, you'd have the first test done within 2 days after exposure. So 2 days to be exposed and then maybe acquire an infection. Within 48 hours, you go for a test. If that test comes back negative, then you continue to use masking throughout your time at work and go on 5 to 7 days after your high risk exposure. And then if you test negative again for that second test, then you can continue to work. So it's not going to require a quarantine afterwards, but it's going to mean that you would have to be separated from the person. If it happened to be a home exposure, someone in your home, you're going to have to continue quarantine for 10 days probably afterwards. So there are going to be a lot of unique variations on this, and that's where going to the guidance that has been consolidated, and then there's a link in there to healthcare worker exposures that will take you to a second web page for that you can help look at each individual situation. So after that, if you did have that high risk exposure and you had to stay out, then it's pretty much 10 days. After 10 days, you can return to work. Although CDC recommended on this that you continue what they call universal source control, wearing that mask for a full 14 days even after that. Now, there was an additional in here. If someone has had a COVID infection, then they shouldn't go for a test within 90 days afterwards. Why? Because they have such a high titer of antibodies that they might get a false positive with it. So within 90 days, it's considered that you do have antibodies after you're past that 10 days of infectivity, and you would not go with testing. So there's some specific allowances in it. So I'm going to go through. When you go down the page, there is on this consolidated webpage a segment for dental professionals. And there are about 6 different additions in there. And number 1, it said, I'm repeating, know what your community transmission is. Number 2, do not treat infected patients. We're real fortunate in the orthodontic community. We can postpone treatment. The only time is maybe if you had a pokey sticky, an arch wire or a ligature tie, and we can quickly make that adjustment, maybe not even bring the patient into the office. I know during the closure, we even had drive-by orthodontics. So however you can get that patient comfortable, that comfort visit during that time. And then number 3, wear an N95 respirator for all aerosol generating procedures. And again, this is dental guidance, but CDC was very specific. When you use an ultrasonic scaler, when you use a high-speed handpiece, when you use the air-water syringe, you know that like the blast, it's like a pressure washer when you push both of those buttons together, when you use air polishers, or when you use air abrasion. So specific guidance, you should be wearing an N95 respirator at all times in your office. And then number 4 under it, have individual patient rooms. So that's difficult with open bays in our orthodontic offices. We've talked in the sterilization room episodes about having that separate office. Many orthodontic offices maybe took an additional room, a treatment coordinator room or something that was not in use, and changed it to an enclosed room. And then number 5 ties right in with that and says you should have, if you have an open bay, open office design, that you should have at least 6 feet between each patient chair. Barriers should be installed in between those chairs, and they should be easily cleanable and disinfected, that you could disinfect those barriers, and they should not interfere with the emergency fire sprinkler system or with the heating and air conditioning system. And then finally, CDC went on, and this is where we're getting to some guidance with the air and the ventilation in the building. Now, OSHA's been very specific about air and ventilation to the point of installing MERV 13 filters in your office and ensuring that you have 6 air changes per hour in your office. That's recommended from CDC, but CDC also said under the dental guidance on this consolidated webpage that you should orient all patient treatment chairs so that the returned air, the clean air, is flowing over the patient's head and whoever, the clinician, the orthodontist, or the orthodontic assistant that's treating. That's difficult to do in our offices because most heating and air conditioning systems are designed that all of that return air is around the periphery of the building where the windows are. And historic design put those return air systems there because that's what kept buildings comfortable with a uniform temperature, not having cold spots or hot spots with it. So in the future for healthcare ventilation design, I know Joyce Matlack and I have talked a lot about this. What's the future going to be? If you build a new office, you may have a reverse of what was the traditional ductwork and how the ventilation was. But again, if you can reorient your chairs so that you can have that clean air coming in, and then ensure that the final recommendation was ensure that there is adequate time in between patient care to clean and disinfect between patients. So that's going through what the guidance is during this, say, orange and yellow risk of transmission. And if you happen to get into, I'm not going to say happen, when you get to the blue area, infectivity is under 5%, then CDC says you can discontinue source control. That's going to be a big change for us. Now we don't have to ask our patients to wear a mask when they come into the office. We could put the chairs closer together in the reception room. We don't have to have that 6 feet between the chairs with it. And the administrative team might not have to wear a mask anymore. So we're looking at getting past the pandemic, getting to a more normal time with it. So it's good to see both OSHA and CDC giving guidance for not just while we're in the red zone of high infectivity, above 10%, but what's the future going to hold? Where are we going once we get more people vaccinated and infections start to subside in our communities?
Okay, great. Well, thank you for that rundown, Jackie. Now, before we end this episode, you wanted to talk about a new resource CDC is making available for the orthodontic team and really all of dental. It's a free CE credit course, and we love those. It's on infection control in dentistry specifically, and even better, it's going to be available on demand for foreseeable future. Is that correct?
Yes. I am so excited about this, Allison. This is an educational resource that the dental profession has needed. And CDC published in 2016 their updated infection control guidance. So this is not COVID guidance. This is basic infection control. What we've talked about in previous In the Sterilization Room episodes. How do you disinfect surfaces? How do you sterilize hand pieces? Doing sterilization monitoring on your sterilizer, hand hygiene, all of those basic infection control. Now, if you have a new team member come into your office, and we all know there's been a shortage of staff members, you have a resource available to you at no charge that is credible, is going to provide 3 hours of continuing education, free, on demand. It is created by CDC. CDC had a training module on infection control since this 2016 publication, but it was very tedious. It was slides. You had to read through it. This is a much easier format to follow. It's much more user-friendly with it. And again, you get your documentation that you've completed this core infection control program, and that can be used for if you're a registered dental assistant, a registered orthodontic assistant, that for your license renewal with it. And so I would highly recommend that. And it will help in those states where it's allowed that you can do in the office training for an orthodontic assistant. What a great way to orient someone who is new to the profession and needs that basic infection control and sterilization training, to have them go through the modules, receive their continuing education for it, and know that they've got those basics, that it's going to prevent breaches in infection control and reduce risk. And I'm going to follow up with this on, I'm going to give a shameless personal plug and a plug for the American Association of Orthodontics too. Next week on September the 23rd, the AAO has a webinar posted for all of the AAO members that is that I'm giving an update on where are we now, what do we need to be doing with both OSHA and with CDC guidance, what's the infection control and safety, and it's going to be a rapid information source, but it is a good update as we navigate through this high infectivity of most of us being in the red zone now. What do we need to be doing? And with all of the mandates, vaccine mandates, what about the vaccine? Are we going to receive a third dose? You know, all of that information I'll be covering in the AAO webinar on September the 23rd. So I hope everybody can join me.
Great. Well, I know that it would be very informational for the orthodontic team if they attend, and also definitely check out the CDC offering, because it sounds like it's going to be a great resource.
The CDC educational program is the Foundations. That's what it's referred to as, Foundations, and it is going to be building the safest dental visit. So if you go to the CDC website and you type in Foundations, building the safest dental visit, it should take you to that. And Allison, I'd appreciate it if you could post the link on maybe a banner on during our video.
Absolutely. You will probably have already seen it, and if not, it will be in below the video. So check that out. Well, thank you so much, Jackie. It was great to see you. And we will be back for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website, orthodonticproductsonline.com. Until next time, take care and stay safe.